super excited to have Tim share this morning. Tim is one of our graduating fellows and came to us via the University of New Mexico. He was Amber Price's one of her I guess, junior residents, kind of, sort of. But Amber actually started talking about Tim back when she was a fellow and said, like, this guy's the real deal. And we've had the privilege of having Tim for the last year, and I can say, like, this is an amazing man that's going to make a big splash when he goes back to Texas, the great country of Texas, where he's going to be practicing in the Dallas area. And we're super excited to send him there. And I know he has his aspirations personally with regards to even this topic and his own practice that he's going to. And it's been fun to be with him along that journey of not only growing as a spine surgeon, but growing as a leader even within this last year. So, Tim, love this topic. Super apropos to bridging the gap happening here, obviously, at the end of this month. And look forward to hearing this talk. Thanks, Tim, for all you've done this year.
Thank you so much for that great introduction. So we'll just jump right in. I wanted to share my thoughts on this topic, surgeon leaderships, from the thoughts from a fellow. So I want to go over an outline. I want to start off by defining leadership. Where do I start? Applications of a surgeon and dealing with difficult people, situations, and overall why it matters. I want to start off with the talk with this question: what is a leader? Think about what that means to you, whether that means getting results, bringing the best out of people, compromise solution, from someone who guides a team to someone who inspires others. A classic definition is that leadership is fundamentally about influence and guiding others towards a common goal. Leadership expert John Maxwell put it, it's not about titles, positions, or flowcharts. It's about one life influencing another. In other words, a leader isn't simply the person with authority. A leader is someone who positively influences and enables others to achieve results. Effective leaders engage teams, communicate a vision, and instill trust so that people want to follow. Here's what comes to my mind when I think of that question. Abe Lincoln, Barack Obama, Mandela, George Washington, Jamie Bruffy, Trump, Gandhi, Greg Mundis, MLK, Alexander the Great, Bobby Slack, and Dr. A. So what do all these leaders have in common? First of all, they're all great looking guys. And more importantly, they're adaptable and drive a common purpose. Despite their vastly different personalities and styles, all great leaders have one thing in common: adaptability. While contexts differ, the essence of effective leadership remains grounded in enduring principles that leaders adapt to their situation. Each with a unique leadership style, these leaders found the right pocket of constituents to lead their charge, skillfully transforming feedback into effective leadership. Effective leaders can adjust their style, strategy based on the needs of their team and environment. They listen to feedback. They're willing to pivot when circumstances and environment changes. This doesn't mean that they have no core principles. Rather, they stay true to their vision while flexibly managing how to get there. So modern leadership experts emphasize that no single style fits every situation. A surgeon leading an OR team, for example, might normally employ a collaborative tone, but must be decisive and directive in a crisis. Conversely, in a clinic or team meeting, a more democratic or coaching style may yield the best results. The most effective leaders are learning agile. They're able to learn from experience and adjust their approach accordingly. This adaptability allows them to survive and thrive in changing conditions. So where do I start to develop this leadership and the traits that nurture it? There's plenty of resources and books to help guide us. Ambitious by Amir Kaisi, he came to the talk last year at Bridging the Gap, highlighting his book and the traits that make an effective leader. So he said, a leader needs to be both humble and ambitious. Some key points that he made: recognizing and admitting limitations from the leader, active listening, learning from others, drive for excellence, setting that bold vision, advocating for the team's success above an individual's glory, staying accountable for results and culture that that he or she creates. Excuse me. This wouldn't be a leadership talk if I just slide with a ton of leadership books. So there's a lot. There's a ton of information on how to become an effective leader, how you know which book to choose or where to start. You might get some synopsis from people that have read it, but you kind of don't. There's a lot of information out there. There's no single golden egg book that'll instantly make you better. So leadership is a skill developed over time, and different authors have different insights. One author might exhort servant leadership, another transformational leadership, etc. The abundance of books simply reflects that leadership is very complex, situational, and you have to start somewhere and keep learning. There's many different takes on how to become a great leader, like I just said, but one that resonated with me was a TED Talk by Simon Sinek, who's an author, motivational speaker, and business consultant. I wanted to play a clip from his TED Talk, and he popularized this concept of start with why. So let me pull that up here. Oh, sorry.
It's the complete opposite to every Apple or Martin Luther King or the Wright brothers. They all think and communicate the exact same way. It's the complete opposite to everyone else. All I did was codify it. And it's probably the world's simplest idea. I call it the golden circle. Why, how, what? This little idea explains why some organizations and some leaders are able to inspire where others aren't. Let me define the terms really quickly. Every single person, every single organization on the planet knows what they do 100%. Some know how they do it, whether you call it your differentiating value proposition or your proprietary process or your USP. But very, very few people or organizations know why they do what they do. And by why, I don't mean to make a profit. That's a result. It's always a result. By why, I mean, what's your purpose? What's your cause? What's your belief? Why does your organization exist? Why do you get out of bed in the morning? And why should anyone care? Well, as a result, the way we think, the way we act, the way we communicate is from the outside in. It's obvious. We go from the clearest thing to the fuzziest thing. But the inspired leaders and the inspired organizations, regardless of their size, regardless of their industry, all think, act, and communicate from the inside out. Let me give you an example. I use Apple because they're easy to understand and everybody gets it. If Apple were like everyone else, a marketing message from them might sound like this. We make great computers. Beautifully designed, simple to use, and user-friendly. Want to buy one? And that's how most of us communicate. That's how most marketing is done. That's how most sales is done. And that's how most of us communicate interpersonally. We say what we do. We say how we're different or how we're better. And we expect some sort of behavior, a purchase, a vote, something like that. Here's our new law firm. We have the best lawyers with the biggest clients. We have, we always perform for our clients who do business with us. Here's our new car. It gets great gas mileage. It has, leather seats. Buy our car. But it's uninspiring. Here's how Apple actually communicates. Everything we do, we believe, in challenging the status quo. We believe in thinking differently. The way we challenge the status quo is by making our products beautifully designed, simple to use, and user-friendly. We just happen to make great computers. Want to buy one?
So, so that focuses on the why. So starting from why you're doing things to how you do it and what product that you're selling. And so does it matter to me as a spine surgeon starting practice? And yes, the reality is that healthcare, every practicing surgeon is a leader in some capacity. We may not all become CEOs or department chiefs, but we must lead our teams to provide effective, safe patient care. If you're running a clinic and operating room, your default in a leadership role, whether you embrace it or not. And considering our day-to-day responsibilities, we have clinics to run, coordinating front desk, MAs, nurses, schedulers, radiology techs, etc. We have ORs to run, working with anesthesiologists, scrub techs, circulating nurses, reps, trainees. We often lead multidisciplinary care teams, collaborating with hospitalists, physical therapy, pain specialists. So we need to manage upward and outward as well, fitting into a large practice or academic department and building referral networks with other physicians. So in each of these spheres, someone needs to set direction, align the team, and adapt when challenges arise. If not, chaos or mediocrity ensues. Surgeons are frequently the de facto team leaders in patient care situations, from operating room to the outpatient clinic. Our teams often look to us to coordinate efforts and make the calls and decisions. Therefore, if we're just doing nothing and focus solely on our technical skills, we risk the wasting our potential and failing to maximize our team's performance. None of us got to this point in our careers by being mediocre or passive. We've been proactive in mastering surgery, and we have to apply that same mindset to mastering leadership on the job. Leading in healthcare directly impacts outcome. An article from the American Hospital Association stated that poor teamwork and communication are a major cause of errors, with the Joint Commission attributing an estimated 80% of medical errors tied to miscommunication between caregivers. And effective team leadership and communication improve patient safety and outcomes. For example, a recent study from the surgical endoscopy found that those who cultivate constructive leadership styles, such as encouraging, cooperative, open to feedback, had significantly lower complications than those with hostile or arrogant styles. So in other words, how we lead our team is an important part in our patient treatment. So how do we go from this to this? No one else will do it for us. And most of our training formal leadership education was minimal. A few of the experiences that I personally had during residency was the AOA leadership course and some meetings during residency on the importance of emotional intelligence, or EQ. Yet when you start practice, suddenly you're expected to run a team efficiently. If we ignore leadership, we may end up with a dysfunctional clinic, frustrated staff, poor patient experiences, and personal burnout. On the flip side, if we embrace our role as team leaders, we can elevate our practice, provide better care, build stronger reputations, and achieve more influence in our organizations. So bottom line, whether we like it or not, leadership is part of the job description of being a surgeon. It's essential at the most basic level, and we know something about how to lead, and that we know something about how to lead and work with people, not just how to operate. The great news is that leadership skills can be learned and practiced just like surgery. And so how can an outgoing fellow begin to think about this? And here are some of my thoughts, and at least how I've been thinking about it. So rather than talking abstracts, let's discuss concrete situations where we spine surgeons must lead, and some simple strategies to do so effectively. We don't need to reinvent the wheel, and keep it very simple and focus on proven practices. Here's the key domains of our work and how leadership plays into each. So starting off with the clinic, picture your day: front desk, scheduler, MA, nurses, techs, PA. They're all working together to serve a slate of patients. And as a physician, you are the common link and functionally the team leader in the clinic operations. Your goal is to convince all these people to work together toward the same goal with you and for you, namely providing excellent patient care efficiently. So why would they follow you? I think that you have to first know your personal why. For me, and likely for you guys as well, it's to do my absolute best to provide a better quality of life for my patients. And simply put, I care a lot for the patients. After all, like, the staff members have their assigned duties and paid hourly. It's easy for them, especially when it gets very busy, to fall into "that's not my problem" or a bare minimum mindset. Your leadership challenge is to create buy-in. To inspire your team to go above and beyond because they want to, not just because it's their job, and have them buy into the why. When a patient cancels last minute, will your schedule make the extra calls to fill a slot? When there's complicated social issues, will a nurse sort it out now versus next week? So these kind of extra efforts can dramatically improve patient care and practice efficiency, but they require a team that's motivated and engaged. So I think this will take some time. We're all going to be moving into a new office with people that have been working with one another for a while, and then trying to get their buy-in to your why will be difficult. They don't know you and you don't know them. Each one of us will have our own flavor of doing this, but there are some thoughts and steps that I will incorporate as I transition into practice. I believe that you have to start with respect and showing that you really value them. Nobody cares how much you know until they know how much you care. It take time to get to know your staff as people, like learn their names, obviously, say good morning, ask about them, etc. A little genuine interest goes a long way. Investing a little time can snowball into huge future benefits. For example, spending 30 minutes to meet one-on-one with your nurse or scheduler and discuss how you can improve clinic flow, and really listening and taking their feedback could save you countless hours later, because they'll take ownership of implementing solutions. And during this time, you can invest in learning their why. All these people chose to work in a surgeon's office or clinic, and I'm going to learn why that they wanted to do this. Each of us had to tell our mentors here in fellowship why we wanted to pursue this career or join this spine surgery fellowship. So I'm sure that each of these people in your clinic that make up your team have a reason behind their careers also. So show genuine interest in this, and I believe it can lead to massive dividends. So getting buy-in. And so we got to start with empowering and trusting our team members. If you treat the staff like cogs in a wheel, like, or in a machine, they'll act like that. So instead, give them autonomy, respect, and encourage them to suggest improvements. Let your coordinator rearrange schedule if it makes sense. Let the MA decide how to triage calls, for example. Show that you trust their expertise. And research shows that empowered staff are more motivated to solve problems practically and use their strengths, and also help with patient satisfaction. And so in short, trust your team to do their jobs well, and they'll rise to the occasion more often than not. Appreciate and recognize their efforts. It can be simply saying thank you or for staying late, or sending an email praising a good catch. Recognizing staff contributions boosts overall morale for the team. And some physicians implement small rewards, such as buying lunch or a shout out or something. Dr. Stefan does this really well. He buys lunch for his entire clinic staff, almost every single clinic. So these gestures send the message so that you notice their valued hard work. Team feels valued will go the extra mile more readily, like working through lunch or a double booked clinic or starting clinics early. So finally, lead by example. If you want a culture of going above and beyond for patients, show that in your own behavior. Effective leaders model the way, demonstrating work ethic, integrity, and service attitude that they expect from others. So especially as a new surgeon, don't be the bull in China shop, but I'm just kidding. Boards begin to establish the clinic with the demands. But do
For Gotham.
but do you take initiative to build relationships and trust? I was gonna put Nikita, but he's not here, so it's not fair. A little humility and effort will pay off exponentially in an efficient, happy clinic. So moving on to the operating room. So leadership here, it's similar concepts, but high stakes environment. The OR is high stakes, high stress, essentially the arena where our technical training meets teamwork under pressure. Leadership in the OR is unique. As a surgeon, you're the captain of the ship in terms of making decisions for the surgical procedure, but you also function as part of a close-knit crew of co-leaders, the anesthesiologist, the nurse, scrub tech, etc. Everyone has a specialized role, and success depends on coordination, communication, and mutual trust. The team's made up of all these people. A leader sets the team up for success before setting foot in the OR. This means doing your homework, making sure your preference cards are up to date, talking through the game plan with the rep so that all the instruments and implants are there and ready, communicating to anesthesia in advance about any medically difficult patient, and briefing the OR for the game plan for complex case. And most importantly, planning the surgery well. As Dr. Mundis puts it, we execute these surgeries like a Navy SEAL team. A brief pre-op huddle or checklist review can improve the team orientation and efficiency. Studies show that the checklist and briefings improve OR culture and reduce errors by aligning everyone's understanding of the plan. When the team sees that you're organized and proactive, it builds confidence and trust in your leadership style. So, open communication. So, establish a culture of open communication. Historically, ORs were very hierarchical. Nurses or residents wouldn't ask questions to surgeon, and unfortunately, it's the case in some hospitals and ORs still. Definitely not our hospital though. An article out of the American College of Surgeons strongly indicates that a strict captain is always right culture is dangerous. If team members are afraid to speak up when there's something wrong, mistakes go uncorrected. Although it may once have been common for a surgeon to discourage others from questioning or reporting errors, that behavior negatively impacts team function, morale, and patient outcome and safety. Great surgical leaders foster psychological safety in the OR. They encourage questions and input and respond to concerns with openness rather than anger. So like Dr. Isak always says, if you don't know, then ask. He's always open to communication and asking. When someone does speak, thank them rather than reacting defensively. This creates an environment where everyone feels responsible for patient safety. In a psychologically safe OR, team members feel empowered to admit errors or suggest ideas without fear of humiliation, which leads to catching problems early, better patient outcomes. And so, importantly, psychological safety doesn't mean a lack of discipline or standards. It means maintaining respect and openness alongside high expectations. So be approachable. Being approachable and calm, the surgeon's emotional tone sets the tone for the whole OR team. Even though we're going to be new, people are still going to be looking up to us as a surgeon in the room. If you're freaking out or snapping at people, the stress multiplies and performance suffers. Creating a fearful environment lowers the people's ability to people's overall ability and function. So emotional intelligence is critical here, such as self-awareness and regulation. The emotions of a leader often set the tone for the entire team. Self-regulation is stressful. In stressful situation can inspire calm and cohesiveness, whereas distress, angry outbursts from the surgeon can significantly hinder the team. In practical terms, this means making conscious efforts to stay calm and focused even when complications arise. If something is wrong, speak in a clear, controlled voice. Don't burst out in yelling. If you need a moment to think, to take a deep breath rather than yelling, your composure will help the remainder of the team maintain their cool as well. Be approachable. Being approachable also means the staff won't hesitate to alert you to an issue because they're not afraid of being bitten. So lead and also follow as needed. As a great OR leader, you have to also know when to defer to colleagues' expertise, like a code or a patient crash, for instance. The anesthesiologist or an intensivist might effectively take command of airway resuscitation and writing the code. You have to adapt to a supporting role, doing chest compressions or gaining access as directed. It's not a blow to your authority. It's intelligent leadership to let the person with the needed expertise lead that part while you assist. Highly reliable organizations like the aviation or military operations have a concept that expertise that might be empowered to make the call. As surgical leaders, we should check our ego, prioritize patient's welfare and safety. And sometimes that means following the anesthesiologist's instructions or asking the scrub tech about their experience and opinion about instrumentation or opportunities. Voices of others can raise important issues. And so true leadership in the OR is a team sport akin to a co-pilot relationship. So the crisis in the OR. During a crisis, when a complication or unexpected event happens, major hemorrhage, equipment failure, signal loss, dural injury, it's the ultimate test of OR leadership. Your role is to communicate a clear plan, delegate tasks, keep the team focused, speak up with decisive voice, such as we have a tear in the iliac, I need suction, pressure, call vascular, hopefully vascular is in the room, and get blood. And so use names if possible. Delegating is key. You physically can't do everything, so assign roles, call for extra help, etc. At the same time, control your emotions. Panic's contagious. Maintaining a steady, even tone can prevent the atmosphere from devolving into chaos. Don't hesitate to ask for help. Calling another surgeon for assistance or requiring an extra anesthesiologist in a tough situation is not weakness. It shows strength and good judgment as it puts patient safety first. A JACO review of the OR Sentinel events often found that communication failures and not asking for help were factors in bad outcomes. So leading in a crisis means both directing the team and recruiting all necessary resources calmly. A well-led team in a crisis can turn a potential disaster into a managed problem. So I had a personal experience with this 2 weeks ago or last week. So during our ALIF, there was a tear in the left iliac and like blood pooled within the abdomen super quick. We lost about like 1.5 liters of blood in less than a minute. Our vascular surgeon, Dr. Chandra, stayed calm, called for a larger suction, told anesthesia and circulator about the blood loss and to get blood in the room. And asked Dr. Mundus to scrub in right away. And so with our assistance, while he was using laps, sponge sticks and pressure just to help stop the blood loss. And fortunately, we were able to repair it and patch it up. So this is one situation where you have to act very quick, communicate efficiently to get the situation under control. One of the most important things that we did after the crisis was debrief about it. So Dr. Mundus and I talked about what I would do in a situation like this, especially if I was by myself during a lateral approach. And so that really burned and seared this into my brain to have these steps. So first, visualization, get a large suction possibly a second one, get hemostasis and packing agents such as gel foam, Surgicel, thrombin, Fibrillar, and then pack that area to get hemostasis. And most likely it'll be, from what we talked about, a dorsal venous bleed. And so it's a low pressure system, and hopefully the packing will be likely enough to stop it. So in summary, OR leadership for surgeons is about creating a climate of trust, communication, and mutual respect while maintaining high standards and focus. By being prepared and communicating clearly and treating your OR colleagues as valued team members, you not only improve morale, but improve patient outcome and safety. An effective OR leader harnesses the full team's abilities so that the sum is greater than the parts. As a fellow and new attending, introduce yourself to the OR staff, learn names. Don't be afraid to say, hey, I'm new here. I value what you have to offer and your expertise. This humility can earn you goodwill, and always debrief, ask the team what they think went well, what could have been better. It shows that you're open to feedback and reinforcing that collaborative culture. So moving on to patients, perhaps the most important leadership role we have is leading our patients, by which I mean guiding them, winning their trust, and enrolling them in the plan of care. Surgeon-patient relationship is a special dyad. The patient often comes to us in pain, they're vulnerable, and seeking help and answers for their spine issues and problems. To proceed with surgery or any treatment, the patient has to trust us 100% with their overall life and well-being. It's not automatic that we gain this trust. It has to be earned through the leadership in form of communication, empathy, and reliability. So how do we lead these patients? First, build a connection. It starts in a clinic consultation. Rather than being rushed, purely technical, talking discussion, take a moment to connect as humans. Listen actively to their story and empathize. Interpersonal communication is crucial to forming trust in the surgeon-patient relationship. Patients gauge not only your credentials, but how you make them feel. Simple actions like making eye contact, sitting down at eye level, and showing you understand their goals can establish this rapport. Demonstrate competence and honesty. Of course, patients also need to feel you're technically and intellectually capable. Leadership here means educating and reassuring the patient with honesty, explaining the diagnosis, plain and clear language, not jargon, outline the risks openly, and express your confidence in a positive outcome when appropriate. When patients sense both expertise and candor, trust deepens. Never promise what you can't deliver. So under promise, over deliver is a good leadership mantra with the patients. And be the quarterback of their care. We're not primary care docs, but let the patient know that you and your team will coordinate everything. For example, say something like, I have a terrific team, my nurse, scheduler, MA, we've all worked together. We will be all working together to take care of you. It instills confidence that the entire supportive unit is behind the patient. And importantly, if your office says they'll do something, ensure that they follow through. If you tell a patient, we'll schedule that MRI and call you, make sure it happens in a timely manner. Reliability builds trust. And foster realistic optimism. A leader for the patient balances hope and realism. You want the patient to feel hopeful that things will improve. That's why they came to you. But also educate about the process, potential setbacks, lay out the plan. Here's what we're going to do. Here's what to expect post-op. Here's how we'll handle any bumps in the road. This gives the patient a vision to follow, their end of goal recovery, a roadmap, essentially leading them through the recovery and treatment journey. And always invite question. Informed patient who feels heard will be more engaged in their own care. And building trust through team interactions. Interestingly, research indicates that patients Also form trust by observing how the surgeon interacts with the staff and the system. If a patient sees you treating your nurse or hospital staff with respect and teamwork, it boosts your credibility. And conversely, if they witness rudeness, disorganization, it can undermine confidence. So leading well and kindly in front of your patients not only helps the team, but it directly influences the patient's trust in you. So why is this all critical? Because if patients don't trust us, they won't choose us. No trust, no surgery, and beyond the business impact, it means no chance to help them. A lack of trust can lead to poor compliance, misunderstanding, and even legal issues down the line. And on the flip side, when a patient truly trusts their surgeon, they feel like they're part of the team. They are more likely to have satisfactory outcomes, even when the outcomes are a little bit suboptimal, they handle it better. And as surgeons, we are asking people to undergo significant risks. It's a profound leadership responsibility to earn and safeguard that trust throughout this process. Next. So within the practice. Lastly, consider your role within the broader practice or department. As a new surgeon, whether you're joining a group of private surgeons or academics, you're essentially an entrepreneur starting a small business under a large umbrella. Leadership here means how you present yourself among other surgeons, how you grow your influence or market share over time. That means leading by example and building trust, not just with patients, but with other physicians who might be sending patients your way. Establish your reputation through reliability. Early on, you may not have volume or name recognition. You certainly won't, but you can start building a reputation. Be known as a surgeon who's always available and helpful. Network and communicate. Don't sit in isolation. Attend department meetings, surgical conferences, events, social gatherings. Their chances to informally lead by sharing ideas, showing interest in others' work. Sometimes leadership among peers is as simple as being the one who fosters collaboration. Also share credit generously if a case goes well thanks to a referral. Let that doctor know the outcomes and thank them, such as shooting a text or email. Building these relationships is a form of leadership. You're creating a community of trust. So patience and consistency. This will take time to build up this referral network and a busy practice. So I asked Dr. Eastlak how long it took him, and he told me that it took about 10 years for his referral base to fully mature. It doesn't happen overnight, but each year of good work and good leadership to the patients and also your peers add up. Word of mouth based on trust is very powerful. So focus on one patient at a time, one referring doc at a time, and do right by them, and gradually you become the go-to spine surgeon. Be the teammate others want to work with. Within a group practice or academic team, you also want to lead among your peers by contributing. That means volunteering for a committee, helping draft protocols, or mentoring residents, fellows. Especially as a junior person, showing initiative demonstrates leadership potential. It also fits with the idea that if we don't do anything extra, we waste our potential. Stepping up when others don't will set you apart. Your seniors will notice that you're invested in the group's success and not just your own path. That can lead to being entrusted with more responsibility and opportunities down the line. So leading in a practice is more subtle. It's about reputation, relationships, and showing initiative. Treat your colleagues like you would your team, with respect, reliability, and a collaborative spirit. And over time, you'll lead by virtue of being someone that people trust and look to for answers. So application of this leadership. So we have to first learn the current system before making any big changes. You have to thoroughly understand how things currently work. If we are joining an existing practice, and we all are. We have to spend the first few weeks mapping out the potential journey. So envision the patient's first call to clinic check-in, to pre-op, to surgery, post-op, the follow-up, and billing. Meet the key players in each step. So front desk, OR scheduler, pleasure, and ask questions. You might discover, for example, that the reason cases start late is some bottleneck further up in the stream. And if you didn't learn that, you might be blaming the wrong stuff. Leadership starts with listening and fact finding, and identify improvements and possibilities as you learn. You'll notice things that could be better. Listen and prioritize. You can't fix everything at once, especially as a new surgeon. Pick tangible and effective, achievable targets that would make a real difference, and consider efficiency, safety, and efficacy. What changes would improve these for patient care? Also consider what you can change versus what's beyond your control. Some things might require admin approval or hiring more people, and this might be hard for you to do initially. So focus on things within your sphere, such as like workflow tweaks, communication improvement, etc. Essentially, set a leadership goal, something like reduce clinic wait by 15 minutes, or don't go over the set time, improve OR turnover by better planning. And then implementing this change. Now you have to go for it, put your plan into action, but do so thoughtfully. Communicate to the team why you're doing it. People resist change usually because they don't understand the purpose, or they fear extra work. If you involve them, you get buy-in. Remember what we said about leadership, it's influence and aligning people around a goal. So use those skills here. Provide support and be present. If you're changing a process, be there to help implement it. Just on other people and leading alongside the people that are doing the hard work to make that change. Expect some things to fail and not work perfectly. Not every idea will succeed, but part of adaptability is knowing when to tweak the plan and make adjustments. And finally, evaluate and adapt. After trying something new, circle back and assess. Did it work? Gather information or feedback from the team. Use data if available, such as like turnover times, like all that stuff's logged. So if it's not working, don't be rigid, adapt. Maybe the idea is sound, but it needs a tweak. Maybe it's a wrong approach altogether. Be receptive to feedback without the ego. And so Dr. Mundis and I were talking about this, and Dr. Brandon Carlson, he said, did this very flawlessly. He spent intense 3 months up front scripting and optimizing his entire OR and clinic workflow when he first started practice in Kansas. So a lot of trial and error up front, gathering input, making changes, and that vigorous front-end investment led to extremely efficient practice early in his career, instead of like a lot of other surgeons that go through these slow adjustments and trying to tweak on the go, taking years. And so we have to be willing to revisit and refine that process. So how do we succeed in leadership? Here's some points I was thinking about: self-education, self-study. Just as we read articles and keep up with spine surgery clinically, we can read about leadership and management. And as discussed, there's a ton of books, but start with one maybe for doctors. Like Dr. Mundis has a ton of books. We can ask him for recommendations. If communication is challenging, maybe for you, then maybe read about the emotional challenges or intelligence or conflict resolution. If we're stepping into a new role, perhaps look on like first 90 days of leadership. Additionally, there's articles and podcasts tailored to healthcare leadership also. The Center for Creative Leadership and Harvard Business Review often have pieces on physician leadership. One of the recent Harvard articles pointed out that the most that most surgeons have extensive technical training but lack formal training in soft skills. So needed to lead teams, which is why there's a lot of programs now emerging to train surgeons in leadership. Learn about leaders and about yourself. I think it's helpful to study famous leaders inside and outside of medicine to get lessons, but I think it's just as important to look at yourself with introspectively. Great leaders tend to have very high self-awareness, and so consider taking a personality test, leadership style assessment. For example, the Myers-Briggs or DISC profile, like they're not magic and don't fix everything, but they give you a baseline and insight. And so knowing your default style lets you capitalize on your strengths and work on your weaknesses. And embrace this concept of emotional intelligence. By now, it's clear like self-awareness, empathy, relationship management is very big in leadership. And so if you suspect that your EQ could be actively worked on, work on it. It can be improved through practice, like forcing yourself to listen more, asking for feedback on your demeanor, learning stress management techniques. Ask our members here, like if we need what we need to work on. And then finally, mentorship. We're fortunate in medicine to always have had mentors throughout training. Attendings who trained as senior partners, etc., use these relationships not only for surgical tips, but also leadership guidance. Chances are they've gone through everything that we're about to deal with, and so lean on these great resources. And we have to learn by doing and failing. Ultimately, leadership is learned by leading, and we're not going to be perfect when we start. So start with leadership tasks that are not life or death. Practice of getting people on board, executing and seeing the results. And so we just got to keep working on it, listen to the feedback and adjust to failures, and that makes us better. So I took these tests. Here's some of the this IP personality test. I asked my wife, and she said it's pretty accurate. So there's this Goldman leadership style thing, talking about types of leadership, and they're not perfect, but it said that I was more of a coaching style. But it's a start. It gets you to think about yourself and introspect. And so difficult situations and people, this is going to happen. There's no leadership talk about addressing the tough reality of not that, like the fact that not everyone will be on your side. Not every situation is smooth. You'll encounter those who, for whatever reason, are resistant to change or just plain don't like you. So how do we lead then? I think first we have to diagnose the problem. If a staff member or colleague is not buying in to you as a leader, try to figure out why that is. Is it something that we can change, or is it not? Do they feel undervalued or ignored? Perhaps they resist change because they haven't been included or recognized. This you can change by listening to them, validating their contributions, and giving them a role. Often turning a resistor into an ally just shows that you care about their perspective. Are they cynical from past experience? Sometimes they've seen leaders come and go, they're jaded. You may have to prove yourself with consistency over time, keep communicating and follow through. And so this consistency can erode the cynicism eventually and hopefully. Is it personal to them and not about you? Recognize some issues might not be fixable by you. If a person hates their life at home and brings it to work negatively, you can't really solve that problem. So focus on what you can control at work. Or is it possibly you? Maybe something in your style is rubbing them wrong. Solicit honest feedback from a neutral person or individual if appropriate. Show humility. say something like, I feel like we got off on our foot. I value your experience. Love to hear if there's something I could do differently to work better together. So this can be disarming. It's seeing signals that you're not autocratic and you respect them. And then when all else fails, despite good efforts, occasionally you meet someone that's truly toxic or unsafe to overall patient care. You may have to escalate it, like HR, supervisor, last resort, but patient safety ultimately comes first. So going back to why. Some may think I'm a spine surgeon, this doesn't matter. I just want to fix spines and go home. Why should I spend the effort on becoming a better leader? It's a fair question given our time constraints, but here's why I think it matters. Excellence versus mediocrity. None of us got here into our respective medical schools, residencies, and this fellowship by being mediocre. We always push to be excellent clinically. Why settle for being a mediocre leader or manager if we can excel there too? So as we transition into attending roles, the impact of our decision widens. It's not just our own training on the line, but the entire practice and the patients that we treat. So if we coast, things will probably be okay, but they likely won't be great. So we didn't sacrifice all those years just to be okay. I don't think that's in our nature. So invest in leadership, invest in overall success and excellence. Patients' lives are at stake, essentially. It's not an MBA boardroom. It's our business deals with human lives. Leadership directly affects patient outcomes and safety, as we discussed earlier, with communication and teamwork. So if better leadership can prevent one surgical error or one missed critical finding, it's probably worth it. We owe it to our patients and to lead our teams effectively because it's part of their care. I think this is where it matters most. Team well-being and retention. A high functioning team, a happy team just doesn't happen automatically. It's a result of good leadership, fostering positive workplace. With burnout rampant in healthcare, leadership is actually a tool to combat it. Studies show that supportive leadership is associated with lower burnouts, higher job satisfaction among staff. And so if you create an environment where your staff feel heard, valued, and part of something bigger, and meaningful, they'll be less likely to quit or underperform. Influence on others in the field. By developing leadership skills, you position yourself to influence just beyond your OR or clinic. You can spearhead like a hospital policy change or get on the board, discuss payer contracts, and mentor the next generation. For me personally, like we're going to be private practice under private equity, and so like there's a board of surgeons that overlook the whole process. And so within the next 5-10 years, I think that will be one of my goals to drive some change up there. And then personal and professional growth. Finally, working on leadership makes us better people, more self-aware, better communicators, and more empathetic. These traits spill over into our personal lives too. So professionally effective leadership opens doors. You might be tapped for medical director, department chair, or invited to speak at conferences about how you've improved your practice's outcomes. So we should care about leadership because it elevates everything we do: patient care, team satisfaction, personal fulfillment, and our legacy. We didn't slog through all this training just to be average. Embrace the leadership, and embracing it is how we continue to strive for the next level of excellence in our career. As surgeons, we already lead in the literal sense of making decisions and doing surgery. Now we need to lead in the human sense to truly maximize our potential and not let our hard work be wasted by any like potential soft skills lacking that. And so in summary, get to know yourself, know your team, invest in your team, and be adaptable, communicate, and stay humble throughout the process. And that is it.
Very well done.
Thank you. Any questions, comments?
Internalize all that.
Very important.
Yeah, it's a hard thing, right? Because like in some scenarios, you have to be a follower
or a participant. And in others, you're required to be at the very peak of your leadership. And I think balancing that is not the easiest thing in the world, because it's hard to sort of shift throughout your day. You have to shift from, hardcore leader to, to being, like you said, Tim, I love the different leadership styles that you have to sort of bounce in and out throughout the day all the time. And that's hard. It's like it's almost like emotionally taxing to have to like change who you are, how you lead. And so many default to just their like baseline leadership style. And if it's if you're more of a dictator, then you default to that. If you're more of a, I forget the different ones. If we're collaborator, right? You may default to that. But like if you're an ultimate collaborator, when you pop the vein, like patient's gonna die, right?
What
So
do
it's
you
like,
think?
Yeah. What can I do next?
hey guys, it's like blood pulling out. So, I mean, I I remember like every day you get to be a little bit better than the day before. And there's a guy named Mike Farrington that used to work for Nuvasive, and he had this thing on his door that said #1inch. And it was a reminder for him that every day, if he was just a little bit better than the day before, then he made progress. And I think that's probably the best way to think about it, because you can screw up. That's not great. But if you screw up and you learn from it, that's your inch, right? You just got a little bit better because you learned from something that you did. So just don't ever stop learning, adapting, and it's good. Great talk, Tim.
Thank you. It was a good segue from our leadership meeting last week. Talked a lot about these topics. So.
Yeah. Timmy brought up this idea of adaptability. He brought up kind of the phases of doing that in terms of implementing, reviewing, and then changing. Early on in our careers, obviously the time, because there's where we're like a little quicker than practice in terms of like being patient enough to understand what
How I'm gonna tackle that. Yeah. I think being very organized and like running through that process, like I said, like where does the patient go? Like learning that whole process, not just like the faces that are there, that pre-op or like the OR, and so like going through physically yourself, like what is this patient going to go through, and like where are the potential bottlenecks, and like having that roadmap in your head, I think is, in my opinion, maybe a good idea to have, and like being organized of like all the steps that go into creating the surgery and making it happen. Like the MA scheduler, like the sheets that like they work on in clinic, like what does that all mean?
Mm-hmm.
Where does that go after that? Like why is that sheet so important? And like where did that falter, or is there something, for example, like did it get lost? Like did someone not submit it in time?
Mm-hmm.
The pre-op clearance never happened because communication was lacking. I think if you're like dialed into like your whole team and how they go through this process of setting people up to treat, I think you will have a better understanding of how to fix it more efficiently than being unaware. If you don't know, you can't fix. So I think as we move into our respective practices, like really take that time up front to learn the process. And I think that'll save us time later. Yeah.
You may not know it either.
Yeah.
Right. Yeah.
I rely on my team to tell me what's going on and invest in them and ask for their input on how to fix it, because they know the process better than I do.
Yeah.
There are things you'll have command of your execution in the OR, but all of the processes administratively behind the scenes in the OR and clinic, you may not be privy to. So if you lean on the people that you're working with and bring them into the analysis and the decision making. I think it leads to a better solution.
How are you going to deal with? Yeah. Well, yeah. Let's see.
All right, I'll go first. Tim, you brought up a good point with like treating your staff right and being a leader to your staff. I'll tell you that early on, this is the most time that you're going to have to spend time with your staff. And really kind of being a leader for my team is kind of like just being their biggest cheerleader, and understanding kind of what's going on with them and how their lives are and what's hard for them and how can we make it easier. And oftentimes you guys will see me just kind of sitting in my nurse's office or sitting with my scheduler or just kind of hanging out, and that's me like learning about them and understanding their struggles and how do we make it easier for them, and getting to know their families and everything like that. And that's all just kind of like trying to genuinely be a team with your staff, and ultimately providing them with the support, which is just a different kind of leadership, and just kind of being like, hey, I'm here for you, what do you need? So take this time when you guys start that you have an empty afternoon, and set up meetings or just sit and watch them work and see what they do.
Yeah, 100%. Yeah, I think we can even
would you agree? Oh, I was just going to say that, Stephen, when you need to criticize them or get them to do something different, like when you have that relationship, it works a lot better, right? Like I think that's a big part of it, being able to give them feedback and being able to criticize them. You're not just the boss. They kind of know that you have their best interest in mind.
Absolutely. I mean, but sometimes it also makes it a little difficult, right? Because you're good friends, you're friends with them, you don't want to hurt feelings or whatnot, but they understand it. To them, it's kind of like when we've dropped the ball on like a case being scheduled or clearance, they feel disappointed. Like they feel like like we're all disappointed that the case didn't happen, right? Their body doing it, and rather than like, oh, they messed up and whatever, right? It's more of like, it'll never happen again. We'll figure it out. We're not sure why, So it's just a little bit of a different vibe, and everyone's practice runs differently. But as you're not, as you're starting up and you have that time, really focus on investing in your team.
And what he's really saying there is like you're going to have your own little micro culture, and culture is really, really important. Where you don't mind being able to really. And I asked you guys to write down, like in some ways, like write down your why, because if you've written down your why and you can communicate that with your team, then they know where you're coming from. They know why you're saying, "Hey, I'm." We're really invested in this, and you have to do it a lot. Like you sit down with them weekly, and you're always coming back to the why of why your practice is the way it is, and why your team is what it's doing. Why they're doing what they're doing. So like, I think if you're able to communicate that, what Steven's saying is like, you don't even have to bear down on people because they already are like, dang it, I screwed up, or we didn't do it right. I'm like, yeah, what did we learn from it? Okay, let's go do it again. Like, and they will function for you in a much better way if you get them to buy into your culture. If they're not afraid of making mistakes all the time, if people are afraid, they're just not going to perform for you. But if they're motivated to be better, because they understand the why of why you're doing what you're doing, they'll buy into that.
Yeah, I had one other question for you, Tim. I guess I get staff. Well, you're going to go to Dallas, and you're going to try to employ this I guess new culture, kind of like what we've had here, and we want to bring it to a new place. I guess what are your tactics to deal with, I guess, maybe people who don't necessarily share the same vision or are kind of stagnant to change, and they've been doing this with the other surgeons, their way, and they want you to do it their way. And part of it's meeting halfway, but I mean, what is your I mean, like you're the new person, a new place, and so I think like learning and like getting incorporated into that first, or how they do it, I think is important, and it like builds that trust, and you getting to know that person's getting to know you, and so like once you've established that, it's like, hey, let's incorporate small changes and eventually like fix it, I guess. But I think it also came for me when I was interviewing with the groups and seeing like personally like how those clinics have been operating. I wanted to find a place with a good culture and like efficient, good workplace. And so I think that also comes up in the front end as you're looking for a job.
Yeah.
And so I kind of did that when I was interviewing. Yeah.
Gotcha.
Yeah.
You have to establish relationship, and then the why has to be part of that next discussion.
Right.
You know, if you want to change culture, change the way things are done, people around you that and you're newly there, they need to understand why.
Right.
Can't be I just want to do it.
Yeah. Yeah.
You're going to get resistance. But if you say, hey, we're doing laterals here, we've never done laterals, we have to be efficient because it's harmful to the patient. If we're not efficient in this process, then they can understand why.
Sure. Yeah. Yeah. Definitely. Bringing that awareness. Yeah.
Just the team around you has to understand why, not just you.
Yeah.
And that's communication, relationship. Nice work.
Thank you.